COVID hospitalizations and deaths are both up 21% in the last week. CDC data also shows that emergency room visits for children between the ages of 12 and 15 have nearly doubled over the past week. The current spike is being blamed on kids returning to school and more people staying inside to beat the heat. Joining us now to talk about this and a few other health topics today is Dr. Jeff Pothof, UW Health Chief Quality Officer. Let's talk about this. Are you in agreement that this spike is likely due to back in school?
Yeah, I think that's probably the most likely scenario, especially the CDC study that's looking at those 12 to 15-year-olds. Typically, they're not, our leaders and people who are getting COVID-19. But, the combination of that group being relatively under-vaccinated and now school starting, those kids mingling, it would make sense that we would see more cases in that age group, and those being just a little bit more severe, resulting in emergency department visits, not necessarily admissions. So I'd say not necessarily a surprise.
I'd almost think that even like the younger kids, like kind of like the next group down from the 12 to 15-year-olds, maybe, like the 6 to whatever. Because I have a 5-year-old whose hands are constantly in her mouth, no matter how many times I tell her. And I feel like when you get to 12 to 15, you maybe listen a little bit better. I don't know. The numbers tell us the truth, I guess.
Yeah, maybe so. I think the other thing is, COVID affects different age groups differently. So it could be that those in that little bit older age group, 12 to 15, are having a little bit more severe symptoms. I don't think it's to say that those in the younger age groups aren't also being infected, but they may be managing their symptoms better, less likely to be going to emergency departments, maybe more likely staying home.
That is very interesting to note. Let's talk RSV here for a second. The virus, it can be deadly for infants especially. We've just learned that the FDA has green-lighted an RSV vaccine, not for infants here, but for expectant mothers to protect their babies once they're born. Can you explain this a little bit and how significant this is?
Yeah, this is a pretty neat thing that we have. So, last year, remember, we had that triple-demic. RSV was really bad, along with flu and COVID, and we didn't really have anything that we could do to protect those young infants. And this year, we'll have two things. One is that antibody injection that we've mentioned before. But this vaccine is really interesting in the sense that it's given to the mother who's pregnant. The mother's immune system generates the antibodies against RSV. That protection is then passed to the infant through the placenta, so they're born with protection against RSV for a good couple of months, which is when they're most susceptible. So this is a really interesting way to confer immunity to infants, and a big deal because little infants don't do well with RSV. They end up in a hospital, sometimes in the ICU.
And this obviously isn't the first maternal vaccine. I mean, there's other vaccines that expectant mothers already get because of this very reason.
Absolutely. The Tdap is a good example of this. Diphtheria, pertussis, or whooping cough. We protect infants this way, too, where the pregnant woman is vaccinated and that immunity transfers to those kids before they're born, protecting them during their most vulnerable time.
Really quickly, last question here with 30 seconds left. We talk flu vaccine, we talk COVID vaccine. Everyone's talking about getting the booster this fall. It's variant specific. RSV vaccine is now available for those who are 60 plus. Is getting all three of those vaccines, if you do fit in that 60 plus age group, is that too much at once? Would you advise to kind of split them up? How would you see best fit?
Yeah, I don't actually think there would be a problem if you wanted to go in and get all three of them on one day. We have very good data with like flu and COVID. Getting those together, no problem at all. We have less data on that RSV vaccine. Probably okay to get it if you wanted to be like extra sure that you got a good immune protection. You could get that RSV on a third day, but really important for those folks in that age category, especially if you have comorbid medical conditions, get all three this year. This is the first year we've had this opportunity to protect ourselves against the three main players in respiratory illnesses in the fall and winter. It'll
be interesting to see how many people heed that warning, and then once we're out of the sickness season, how the numbers show there. Dr. Pothof, we always appreciate the insight. Thank you.
Thank you.